Hey everyone, this lesson is on myocarditis. Myocarditis refers to inflammation of the myocardium. Viral infections are the most common cause of myocarditis, but myocarditis may also be caused by bacterial or other infectious agents such as fungus, systemic disease, drugs, and toxins. Acute or chronic inflammation of the myocardium is characterized by inflammatory cell infiltrates and myocyte necrosis or degeneration. Occasionally, endocardium or pericardium can be involved during myocarditis, but coronary pathology is uniformly absent. Myocarditis may progress to a dilated cardiomyopathy in nearly 30% of cases. This is responsible for 9 to 60% of all non-ischemic dilated cardiomyopathy among adult patients. Regarding the etiology, we can classify the cause of myocarditis as infectious causes and non-infectious causes. Overall, viral diseases are the most common cause of myocarditis. From viral disease, adenovirus, Coxsackie virus, hepatitis C virus, and the parvovirus are the most common etiologies. But human immunodeficiency virus and even coronavirus can cause myocarditis. And also bacterial etiologies such as Mycobacterium, Streptococcus species, Mycoplasma pneumonia, and the fungal species can cause myocarditis. From non-infectious cause, autoimmune reaction due to infectious or systemic disorder and the cardiotoxins can cause myocarditis. Autoimmune reaction can be due to exogenous antigen, as for example in the case of acute rheumatic fever, and endogenous antigen such as SLE and the systemic vasculitis can cause myocarditis. Cardiotoxin or drug-induced myocarditis can be toxin associated with hypersensitivity reactions such as snake venom or toxic shock syndrome toxin, and antibiotics, and toxic myocarditis from carbon monoxide poisoning, heavy metals, and ethanol can cause myocarditis. When we see the pathophysiology, myocarditis is characterized by myocardial inflammation, myocardial injury and necrosis, and finally fibrosis. Cardiac enlargement and diminished systolic function are a direct result of myocardial damage, which causes heart failure and arrhythmia. Viral myocarditis may also become a chronic process with persistence of viral nucleic acid in the myocardium and the perpetuation of chronic inflammatory secondary to altered immune response. The altered immune response can be activated T lymphocyte and antibody-dependent cell-mediated damage. Clinical manifestation of myocarditis range from asymptomatic or non-specific generalized illness to acute cardiogenic shock and sudden death. Infants and young children may often have fulminant presentation with fever, respiratory distress, tachycardia, hypotension, galloprythm, cardiac murmur, and older children may complain shortness of breath, chest pain, and associated findings might include rash or evidence of end-organ involvement such as hepatitis and meningitis. Cardiac findings include overactive pericardial impulse, galloprythm, and apical systolic murmur of mitral insufficiency. In patients with decompensated heart failure, hepatic enlargement, edema, and pulmonary findings such as wheeze or reds might present. Regarding diagnosis of myocarditis, we can do biomarkers, imaging, and histology. But the best diagnostic modality is histology by endomyocardial biopsy. On imaging, chest X-ray shows cardiomegaly and echocardiography shows ejection fraction and contractility. Biomarkers such as increased troponin, CK, and other acute inflammatory reactants such as C-reactive protein or WBC can increase. Primary therapy for acute myocarditis is supportive. Management is done according to clinical signs and the symptoms. Conventional heart failure therapy is currently the only accepted therapy for myocarditis, including ACE inhibitors, angiotensin receptor blockers, even though they are highly arrhythmogenic, diuretics, beta blockers, and in patients manifesting with significant atrial or ventricular arrhythmias, specific antiarrhythmic agents should be given. The prognosis of symptomatic acute myocarditis in newborn is poor, and 75% mortality has been reported in newborn who developed myocarditis. But the prognosis is better for children and the adolescent.